Thank you, Mr. President. In simple terms, this bill is a paperwork reduction bill. In the last 10 to 15 years, when I try to refer a Medicaid patient to mental health, I find the waiting list gets longer and longer and longer, now stretching out to sometimes 2 or 3 months to have a patient seen. When we looked into why this was happening, we found out that people are spending more time in some mental health organizations filling out reports and paperwork than they are seeing patients. In my particular practice, if I see a patient for 15 or 20 minutes, I spend 5 or 6 or 7 minutes doing the paperwork involved in reporting and recording that visit. Commonly, in mental health situations, you can spend 20 minutes with a patient and spend the next 40 to 45 minutes filling out the paperwork and paperwork requirements and reporting. When we looked inside this in the matrix, we found that most of that reporting requirements was actually at the state level, not the federal level. There are some requirements that are necessary in order to maintain your funding for programs, but the paperwork burden in these organizations has grown to a level where it's now affecting patient care. This bill very simply states that by the next session we have in February of 2012, we'll have cut through this paperwork and got it down to a reasonable low without infringing on patient rights, patient safety, and patient treatment, and not jeopardizing any of the funds that support those programs. So this is basically a paper reduction bill. I would ask for your aye vote. Thank you.